My name is Ojegwe Chiduma. Based on the last episode of PID, okay, I'm here to ask some questions concerning that because I couldn't understand most of the things, how it's occurred and all that. So I need you to break some things down to really, for those following us to really understand what the PID is all about.
Okay, thank you very much. Still myself, Dr. Edwin Bochiku, CEO Elite Care Foundation. Today, thank God you're following us and you get to hear about the word PID. PID in full simply means pelvic inflammatory disease.
Okay.
It's an infection of the female reproductive organ, commonly with the female. So we say it's often occur when sexually transmitted bacteria move from the vagina to the uterus, to fallopian tubes and ovaries. Now, does it mean that it's only sexually transmitted? No, there's other routes in which you can get PID, which commonly is due to poor personal hygiene and what hygienic procedures, such as if you're menstruating, there's an open portal of the cervix, the integrity of the cervix is compromised. So if you are using wrong things for the menstrual management, for instance, you're using napkin, tissue, unsterilized cotton woods, you're introducing organisms into your water. So the cervix at that time is what? The integrity is what? Is distorted.
Okay.
Some conditions like abortions, mating, in the process of parturition or giving birth to a child, you see that most hands go into the cervix, both sterilized and unsterilized instruments. Same thing with abortion, commonly what we call TOP, terminal pregnancy, in which the abortion is not quite done. You know, go to one part, no sterilized material, and something that is introduced into the cervix, into the what? Uterus and fallopian tubes. Now, but note that PID is commonly sexually what? Transmitted.
So what you're trying to say is only sexual transmitted disease, because in the aspect of menstrual, because the way some ladies manage their menstrual period is not always hygiene. There are some people that use tissue, there are some people that use towel. Pad is very costly now, so you can imagine the spread.
Actually occur both in the
virgin and non-virgin.
Due to what? Poor menstrual hygiene.
Okay.
No.
You actually said this is common to men or ladies. Is it possible for a man to contact it? And if they do, what are the symptoms?
No, very good. I love this question. First thing first, men do not come down with PID. But if you hear the name, it's what? Pelvic inflammatory disease. There are other forms of feet that occur in men. For instance, now it's commonly for a man to have what we call Neisseria gonorrhea and start having painful urination. But let's say Neisseria gonorrhea in a woman can stay without causing any painful urination. So why this PID is a topic of importance? Because most women have no sign or symptom. They might have it without even knowing they have it.
That means there's no, it doesn't show any color for someone to know.
Women, it doesn't show anything. But in some, you might have lower abdominal pain, you might have foul smelling vaginal discharge, you might also have painful sexual intercourse, and also have fever. But in most females, nothing happens. You don't even know it's happening. Because the two commonest organisms implicated is Neisseria gonorrhea and Chlamydia trachomatis. So you see that most women don't even know it's going on.
So how can we know?
Now for chlamydia, you might even culture that's in anything, unless you do chlamydia test.
So there's no stage or which okay, let's say it's getting to 1 week, it will start showing sign of.
That is where the problem lies, is that most time you have no sign or symptom. You might even know that this is going on in your body. Most times it's identified discovered in ultrasound, abdominal ultrasound, when they will tell you that there's a fluid at the patch of Douglas, moderate severe fluid at the patch of Douglas. How can this be? So we now want to do further investigations to know what's really going on with this patient. Now, you see some girls, they're not having any form of discharge, but when you take HVS, we call high vaginal swab, MCS, find out that it's culturing organisms.
Okay. Because there's sometimes you go to the hospital, you do toilet infection checkup, and they'll tell you, okay, you have small discharge. Is it because of the PID or?
Now, medically, there's no one like toilet infection discharge.
Oh,
Every organism is either you go through poor hygiene. For instance, what we call toilet infection is when you don't even know the proper way to clean yourself as a woman. But we're not deviating that way because today we're calling on the word PID. Now, female has not still understand and fathom the fact that being sexually active is not a crime. But managing the sexual activity is where the problem is. Now, one of the risk factors to PID is being sexually active before 25 years, having multi-sexual partners, having unprotected sex, having a partner who has a partner that has a partner. You know that
it's common in Nigeria. Get a boo. It's common.
So you become what I call an incubator for nonsense. Because this organism I have started from some lady,
Pastor A,
who will now move it to another guy, that move to another lady, who move to your boo that gets you.
get boo.
You see that you are single sexual, but they are saying that what multi-sexual. Then it's saying that whoever you're having sex with is also having sex with someone who's having sex with someone who's having sex.
And sometimes it's not even protected.
Now, the question is, that organism has been introduced long time ago and have undergone many changes in the world of what management.
Okay.
So that by getting to you, that organism becomes dormant and silent, and just move to the most important organs that aid fertility, which including the fallopian tubes, the ovary, thereby inhibiting pregnancy from taking place. Now, it might occur without you knowing. Like for experience, in my field of practice, I've had over 20 to 30 young girls who cannot conceive even though they are married. They do hormonal profile, everything is okay. So found out that the commonest cause of infertility among young girls in Nigeria and in Africa at large is what? It's infection.
So, yeah, what you're trying to tell us now that PID can cause you not to give birth.
That is where the problem lies. That you might even realize it's happening.
That means it's a very strong disease that
you
have to
damage organs without you knowing.
Oh.
The day you find that is when you're not married and you're trying to conceive, and pregnancy is not coming. So if they're thinking that your mother-in-law is a witch, if they're thinking that your great-grandfather has committed a crime, they're thinking that your neighbor that you love most has touched your womb and blocked you from getting pregnant.
Okay.
You know that it's just something that occurred in the past that you have resolved. But if you're taking the proper step, never allowing it to linger. So most females notice they have PID when they have trouble getting pregnant.
So when it gets to that point, is there something they can do?
When some organs are damaged, there's nothing much you can do. And not as if it's only causes organ damage. PID can also lead to ectopic pregnancies.
Sorry?
PID, pregnancy pregnancies, can also lead to ectopic pregnancies, in which you have what we call tubular ectopics, because carrying on the tissues.
Okay.
When the sperm swim into where fertilization occur, but there's no way for the zygote to go back into the endometrium, thereby being stuck in that place, giving room to what? Ectopic infestation. You see that apart from the fact that you might not conceive, even though most times when you conceive, you might come down with what? Ectopic. And apart from that, they can also have what we call tubular ovarian abscess condition. Can develop chronic pelvic pain. Not even just say that the something starts having a lower sharp pain in the lower abdomen. That is just solid nonsense. When I see them, I laugh because I know this is what PID playing out.
But you know, it's not something that everybody gets to know. No,
That's
because
why you are advised every woman should always get what? Tested.
okay, if everyone should get tested, what you're trying to tell us, okay, maybe every month or like how often should
Do you advise women to get tested?
First of all, I advise that women should first of all get what I call proper personal hygiene in menstrual management and other what? Female-related protocols. Then secondly, if you're sexually active, you know that you're having sex unprotected. I had advice you seek medical attention at least every 3 months. minimum.
Okay.
Every 3 months. If you have multi-sexual partners, I advise you seek medical attention every month. Because most times the PID is start giving us small little symptoms like irregular menstruation. During your menstruation fast skipping dates. You go to the pregnancy test, you're not pregnant, but the period is coming out.
But you said something about multiple sex with different partners. At the same time, what if it's someone that doesn't have multiple sex?
I give you an instance, see your can even get food.
Yes, we know. But let's, for instance, that the lady is using a condom on the boo and doesn't get the effect, doesn't know about this PID, but because of the other hygiene and all that, she gets it, but she doesn't know. You can't just say it's only sex.
Now, like I said earlier, I said there are other processes to get it, but it's commonly sexually transmitted. Now, in the case that you got this through your personal hygiene, come to the hospital, you find out you have this, you get treated, get a partner, teach you on personal hygiene and menstrual management, and expect you adhere to it, thereby limiting the rate of reoccurrence. But the continuous reoccurrence of PID is what actually gives birth to infertility among the young ladies. PID is not something you joke with, but the common organisms are not funny either. So I advise every young lady out there, visit a gynae clinic, see a doctor. Please, whoever seen a doctor, stop this small lie. When do you have sex last? The last 10 months, when your last sex was last week. Was it with condom? I have never had sex without condom, whatever, then I smell it.
There's no way you will say you have never had sex with alcohol and your vagina will be smelling.
How many this virgin? The girl will tell you it was with condom.
With condom and your vagina is smelling. It's not possible.
That is you coming to your savior online. Open up. When was the last time? If it was there first day, please say it's there first day. If it's with that quotation, please say. In the last 3 months, how many guys have you had sex with? Please be able to say. How many guys will be able to have sex with? Was it with or that protection? The one that we with that protection, please say it out. Because at this point, the doctor is trying to get a history. That we need to work examination and what? Appropriate method of what? Diagnosis. So when you are lying to your doctor, you are trying to tell the doctor not to get to the point of knowing exactly what is wrong with you. So for me, I said to the young ladies, PID is real. And as it's going, females are no longer interested in health. They visit one lab, one chemist, one woman who can mix drugs, and one herbal drugs and take it without thinking of the consequences. So I advise to visit a gynae clinic as a young lady. Explain whatever you're noticing to your doctor. Even though you're not noticing anything, still explain to your doctor how your sexual life has been. When you're done explain to your doctor how your sexual life has been, allow examinations and what? Investigations. If you're treated, please, it's either being the partner to get treated or being the partner to be the partner's partner to get treated, or practice what was safe sex with what?
Condom.
There's ABC of management of sexual activity. The first is what? After treatment, please abstain for a while. Abstinence. The second one is what? Be faithful to one partner. Even though the partner is not faithful. The third one is what? Use of condom. That will call very safe sex. So my advice to young ladies out there who is focusing or impose being involved in regular sexual activity, make use of condom, visit the hospital, get investigated, get treated. Remember, the consequences can lead to what? Ectopic pregnancy, ovarian abscess, infertility, and chronic pelvic pain. So this is not what you want to experience as a young girl who's coming up. This is not the best act for you. Visit the hospital, get investigated, do ultrasound if necessary, get treated. Whenever you're having a discharge you don't understand the smell, please visit the hospital. Remember the vagina is pronounced smell. Right outside it, you want to ask questions. So for the young ladies out there listening to us, PID is real. And from the studies I've carried out so far, now and so good, I found out that by the year 2030 to 2040, 70% of the young ladies in Nigeria, due to lack of questioning, lack of going to hospitals, lack of getting properly investigated, and above all, having multiple partners, might not be able to conceive. So PID is something that is everywhere. It's an everyday clinic visitation. Fertility clinics now are not dominated by mostly young girls who are married and cannot conceive due to PID. You may not be hormonal, you may not be PCOS, you may not come with us, but not effective. Only always and only be the process of what? PID. So please, I advise every young girl out there, visit any hospital close to you that has an obstetric and gynecology doctor, get tested, get treated if it's found. Get counsel about it. Be faithful to one partner. Make use of condom. Remember, the fate of the new generation and the fate of you and your husband lies in your decision today. Going through abortion, please, is not advisable. Because I will say, why would sex be wanted and the pregnancy is unwanted? From that aspect, abortion is highly prohibited in our country. So avoid everything that will lead to it and know that PID is real. Thank you very much.
Okay, you say there is something you said about you don't know stages. It doesn't show if the color of discharge and all that. Okay, will you say that okay, there's a stage you get to where it involves surgery?
Now, very good. That's a very good question. First of all, PID, as I said earlier, the symptom and signs can be subtle or mild. And also remember that some women don't experience any sign or symptom. So now when there is what I call additions of the fallopian tubes, there might be a minimal invasive protocol to do what we call adherolysis. But most times, remember that damage is done might not be totally reversed. That's why most young girls with tubular blockage end up in IVF. So PID can affect that of things. How you know it. Not every young girl, go out there, get your home, get tested. Health counseling and know the consequences of sex before you go into it. Learn how to use protection if you must have sex.
You know, sometimes during this being faithful to one partner, if you are trying to protect yourself with condoms, your partner will be like, okay, you're going out having multiple sex, that's why you don't want us to go road, you want us to use condom and all that. How will you sort that out?
Understand one thing about life. Life's all about you. If your partner marries you tomorrow and don't give birth, you will not remember that it was what it led you to in the past that led you to give birth. You can't marry someone else who give birth. There is kind of where the child is coming from, doesn't it? No, most men cannot impregnate women, but it happens. Because only a woman who knows the exact man that impregnated her.
Yes, true.
So why that partner, so-called partner, which don't even exist? Because remember, I said the first one is what? A, after. B, the first with what? One partner. C, the most important word, use of what? Condom. That partner does not want condom. Both of you should go get what? Tested and what? Treated appropriately. But if that partner you think is not faithful, I advise you quit. If you don't want condom, because your future lies in your hand, not in the hand of the partner.
I said something again about it doesn't show discharge of color or
most
something.
have discharge.
The same thing.
But most people can get discharge at foul smelling, copy, or monodols.
The same thing with men. Or men get have different symptoms.
When they get infected, like for instance, a woman can have MCI which might go inside and remain there before the next one. But for a man, before you know, within weeks, he started shouting like a madman while urinating. They're having pulsy discharge from the urethra. You understand? Yes. So why it becomes an object of concern for the woman is that the woman can spoil it without showing it.
Oh, why is it like that?
Because that's the woman's nature.
Because I've noticed in different cases whereby women, they will have this kind of particular infection. They can stay like 3 months, 4 months. They will not even notice it. But once a man get that infection, to be like hell.
Yeah, because that's the nature of the woman. But we're not going to know on that topic. That should be economic for next time.
Okay.
But today you asked me about period, and I hope my explanation has been gotten that to you and to everybody out there who has heard about period. So thank you very much for coming to our
One last question.
Okay.
Sorry, before we close this. So, it's common in women, right? Is it possible? Yes, I feel it's possible for a married woman that has given birth to still have it, right?
Yes.
Okay. So, if it's possible for them to still have it, how will I put it now? The possibility, is it way higher for them than the single girls that have not given birth?
Now, this question is
Because
dicey.
their body is open. That's
This
why I'm
question
just
is
asking.
dicey in the sense that, first of all, I know that is commonly sexually transmitted. So, and the less common part of it is what personal hygiene. So, if it's commonly sexually transmitted, if you're looking from the right way, if that woman has a good personal hygiene, good menstrual management, that means the only way that woman would have gotten this is through what? Unfaithful partner. I didn't say I was say unfaithful partner.
Married.
Unfaithful what? Partner. We're not pointing fingers. It's an unfaithful partner.
Okay, for in case of those that is,
She's not married to a woman. She's married to a man.
Unfaithful partner.
A man.
You know, we are in a contemporary society where men marry men and female marry what?
Female,
That's why
yes.
we're using the word unfaithful
partner.
partner.
True,
So, it
true.
can be the man.
Because it's all over now.
So, any other clarification you want?
Okay, that's all for now. Maybe if there's another clarification, we'll still reach out to you.
Okay, any other one, Lady?
No, for now.
Okay, so thank you for coming to get clarified and early to engage.
You're welcome.
Remember, we're always here talking about your health as a human being, trying to make you get health awareness, have understanding and health management. But the one man will always say that prevention
It's better than cure.
Have a lovely day. The audience out there, I hope this information serves you right. Visit the hospital, get tested and get. My name is Dr. Pid Explained. Name my humble self, COL.
I am Wombo Gloria Menaji.
Okay, I'm Ojekwe Chidima. See you in next episode. Thank you.